In your present, you talk about the high prevalence of micronutrient deficiencies globally. Can you share more why this is such an important issue?
I think it's the magnitude of the problem that is really stunning, because we are talking about 1.6 billion non-pregnant women and also preschool. But then there are other ages, so we are likely to exceed 2 billion people, which is not a small number. You consider the world population. And also the other things is that not only low middle income country, the high income country also. So those are something that we have to pay attention to.
And are there any life stages in which micronutrient intake is particularly important?
Well, micronutrients has a role to play throughout life stage. The most important one that really has importance from the beginning is the early life nutrition, the first 1,000 days. And this is from pregnancy through the 2 years of life. And what research has been showing to us is that if you don't have enough micronutrient at this time in life, it will have a very long-term effect through adulthood. So it's like a legacy throughout life. And that's why it's so important.
In your presentation, you also shared about the systems approach to address the problem of micronutrient deficiencies in the population. Can you share some of the key elements in this approach?
Yes, because in order to address micronutrient deficiency, you have to be able to address a few systems that can be close linked. For example, the food systems that would supply micronutrient density foods, diversity, and also to the point of healthy diet. Those are important. Then we are talking about in the population that has micronutrient deficiency, they are vulnerable to infection, they get sick a lot. So food system link up with health system, link up with WASH, which is water system, link up with social protection, because these are the age group that we, the most vulnerable population for micronutrient deficiency are usually poorest of the poor. So linking that up. And of course, one of the things that I think would be important to link to has to do with the education as well. So we can think of it as a system approach to try and tackle this micronutrient deficiency.
And last but not least, what is the current knowledge gap in addressing the problem of micronutrient deficiencies, and what directions should future research look into?
There are a few things. First of all, the gaps of data. So far, the data is only confined to 20-some countries, not even half of what we should have. And I think it's not up to date. Many of the low middle income countries, particularly, the data is like over 10 years ago. So first we need up-to-date data just to know where we are, and where really subnational data is also important. The next thing we need to know is that we have evidence to show efficacy of what works, the intervention. For example, like dietary diversity, biofortification, large-scale fortification, and supplementation. We know which of those work, but how to make them work in program, in the country setting, needs implementation research. So I feel that this gap of knowledge is so important if we want to reach the vulnerable population, be able to help them solving this micronutrient malnutrition, and being able to come up with a human capital for that country. And this is the future we have to think about.
Thank you very much.